Hello, we're the American Association of Latino Orthopaedic Surgeons. Our goals are to address the gap in cultural competent care in Latino musculoskeletal health. We also want to expose younger generations to this wonderful field, and we want to aid in the recruitment, retention, and success of talented individuals interested in orthopedics. We also want to provide a network of support for people interested in orthopedics and for people who are in the field of orthopedics. The benefits of being an AALOS member include mentorship, board preparation, networking, job opportunities, research opportunities, grants, and scholarships, as well as many others. Why should you consider a career in orthopedics? Well, you will not go out of business for once. Musculoskeletal complaints are actually the number one reason why people go to the doctor. Latinos are also underrepresented in orthopedics. We only make up about 1.7% of all orthopedic surgeons. If you like your patients to get better, orthopedics is a great field. We also get to operate on the entire body, and we get to operate on patients of all ages, ranging from peds to teens to adults and to the elderly. Orthopedics is also a very well-reimbursed specialty. In addition to this, some of the most well-known orthopedic surgeons were Hispanic or Latino. These include Eduardo Luque, who developed a lot of the spinal instrumentation, and Ignacio Poncetti, who developed Poncetti casting. Also, the surgeries are very fun, and you can get to work with a great group of colleagues. Something that is important to know and why we are reaching out to you is that orthopedic surgery needs people like you. To elaborate on this a little bit more, here are a few words from our Vice President, Dr. Alberto Bolanos.
Being bilingual and bicultural is a huge advantage in orthopedic surgery because there are so few bilingual and bicultural orthopedic surgeons. My non-English speaking patients just love being able to communicate with me and know that their doctor actually understands what they're trying to say.
Orthopedic surgery is also a very diverse field, and it has a little something for everybody. You can do sports medicine, hand, joint replacement, shoulder and elbow surgery, trauma, foot and ankle surgery, spine, tumor, and pediatrics. We would now like to take the opportunity to introduce you to several orthopedic surgeons that would like to tell you about why they chose orthopedic surgery.
Good afternoon. I am Ramon Jimenez. I'm a second generation Mexican American. I have been an orthopedic surgeon since 1972. So I would be characterized as an old timer. I first started out in cardiovascular surgery, but I switched to orthopedics when I found out that orthopedics is really a vast field. 46% of all doctor visits are for musculoskeletal care. Second, orthopedics represented me a career in which I could take a patient, diagnose them, evaluate them, treat them, and with surgery or no surgery, and then rehabilitate them back to the lifestyle, work, sports they were doing before.
Hi guys, my name is Monica Payares Lizano. I'm a pediatric orthopedic surgeon at Nicholas Children's in Miami, Florida. I am originally from Cartagena, Colombia, and I came to pursue my dreams of becoming a pediatric orthopedic surgeon. And I was interested in orthopedics initially because my brothers were diagnosed with leg calf hypertrophy disease. And so that's what interested me in medicine to begin with. And then I found out that not only I like to care for people, I like to do sports and be very active. I really enjoy the musculoskeletal system. I love power tools. And so this was a field that allowed me to do all of those things. Currently working with children, it's amazing. Children have a fantastic way of getting better and healing and really can make a difference in their life as they grow up. I work with a lot of special needs children, which is very rewarding. And I also get to do a little bit of global health. I am married. I have 2 young children. And I love to participate in a lot of different activities. So there is time for everything. You will be able to become a pediatric surgeon, a pediatric orthopedic surgeon, or any kind of physician you want to be. You can still be a mother and still be successful in all those things. You can do everything, maybe not all at the same time, but you will find time to do it. And here at AALOS, we are here to help you navigate the system, provide some mentorship and opportunities, and get you to where you need to be.
I like orthopedic surgery because I help people walk again. I'll sometimes have people come to my office in wheelchairs, and then I do the surgery and then come back walking. It's a dramatic difference. I specialize in joint replacements, and I do a lot of the revision joints, the hard redos. Being able to do that type of surgery allows me to have a busy practice, even in a very competitive environment. I like how orthopedic surgery has allowed me to do other work besides surgery, whether it's my medical expert work for the attorneys or pharmaceutical work or owning a surgery center. It's especially critical to have diversification in times of a pandemic when you couldn't do medicine, everything's shut down.
My name is Dr. Rafael Buerba, and I chose orthopedic surgery because I thought that taking somebody that sustained an injury back to the pre-level of function to be very rewarding. I also thought that the surgeries were quite fun, and I like the people in the field. One thing that's very cool about orthopedic surgery is that you get to operate all over the entire body. You can operate in the hands, the feet, the hips, the knees, the spine. Another thing that's really cool is that you can actually have patients from pediatrics all the way to the elderly. I decided to pursue a sports fellowship because I also enjoyed working with athletes. And this was a very wonderful experience for me as I got the opportunity to work with professional athletes as well as weekend warriors and teenage athletes. My practice is in Arizona, and it's a hospital-based practice. And from there, I take care of patients that have orthopedic problems in the hospital, but then I also have my elective practice where I do sports surgeries, and I also take care of teams in the Phoenix, Arizona area. I'm very happy with my choice of specialty.
No, it's one of the pleasures I have being an orthopod is also being able to teach. Work with residents keeps everything fresh, and it's one of the things that is the high point of my career. So when I was choosing fellowship, at that time, not everyone went into a fellowship. And one of the things that hand gave you was the ability to work around neurovascular structures. So it enhanced your fracture work and enhanced your ability to do complex things. And that's really why I went for the skill set rather than the subspecialty. And over time, I've sort of gravitated more towards just doing hand. Up to October of 2019, I was still taking general call, but haven't since then. I think the thing that I like the best is that it keeps things interesting. We can discuss why we do things, the reasoning behind them, the rationale behind choosing the appropriate treatment. And it makes doing something that I've done a number of times that maybe I wouldn't particularly enjoy anymore, still enjoyable in teaching someone. Well, I think that you want to keep your options open as much as possible, so that you have to strive to do well in your classes, to do well in your testing. You may be surprised that you decide to go into something that you didn't think about before. Specifically with the Latino Medical Student Association, sometimes when I visited, people have expressed that they want to go into primary care to serve their community or our community. But what I always point out is that Hispanics get injured, Hispanics have sports injuries, Hispanics have work injuries, just like everyone else, and it's important still to have that representation. Now, specifically to hand surgery, there are 3 paths to hand surgery. You can do general surgery and then a hand fellowship, plastic surgery and then a hand fellowship, orthopedic surgery and then a hand fellowship. That being said, the most straightforward path, and I, perhaps being biased, consider the best path, is orthopedics. It's very hard to come to hand surgery from general surgery at this point in time.
Mm-hmm. Hello, my name is Dr. Eric Santos. I'm a general orthopedic surgeon practicing in South Texas and an officer of the American Association of Latino Orthopaedic Surgeons. I got interested in orthopedics when I was actually studying engineering. I'm very attracted to the engineering aspects and the mechanical aspects of orthopedic surgery. In a typical day, I see patients in clinic on 2 or 3 times a week, and then go to the operating room twice a week. I also do workers' compensation cases, medical legal cases, and in terms of my chosen profession, to me, it's one of the best specialties in medicine because you get to do stuff with your hands and you get to basically see a lot of satisfaction in your patient, most of your patients getting better.
Hi, my name is Dr. Noor Maza. I'm a PGY1 at Mount Sinai Hospital, and I chose orthopedic surgery because growing up, I used to love dancing and playing sports, so I always felt connected to the musculoskeletal system. And I also grew up working with my hands, so I knew that I wanted to do something surgical. I felt that orthopedics provided the most diversity in terms of patient population, surgical subspecialties, exposures, instrumentation, and it is an elective field, which gives you a lot of flexibility in terms of lifestyle.
Hopefully this video has piqued your interest in orthopedics. Now you may be wondering, how do I match into orthopedics? Well, following are some tips from orthopedic surgeons who recently went through the process. My top tips for matching into orthopedic surgery are doing well on your boards, doing very well on your sub-Is, and having a mentor that can support you throughout the application process.
My advice when it comes to matching in ortho would be find yourself a really great mentor, someone who can guide you in terms of electives and the weight rotations, and who's going to write you a really fantastic recommendation letter and vouch for you when it comes time to apply.
So once you decide that this is what you want to pursue and you have some interest, I would suggest going to your local orthopedic department and see if you can jump in a research project, see if you can have some shadowing opportunities. Organizations such as AALOS, Ruth Jackson, and Gladden Society have mentorship programs, and I think this is key. So reach out, we can help you navigate the system, we can go over your individual application and see what we can make it, how we can make you a little bit stronger.
Thank you for your attention. We hope you enjoyed our presentation. Please follow us on social media at alos.social. And now some parting words from our former ALOS president, Dr. Ramon Jimenez.
And I'll leave you the words of Alfred Tennyson when he spoke about Homer in the Odyssey, and something I lived by since I was in the 8th grade. To strive, to seek, to find, and not to yield. Thank you.